Facial reconstructive surgery covers a wider range of needs than you'd first imagine, from trauma to birth defects and cancer. Dr. Trang Vo-Nguyen of Desert Regional Medical Center in Palm Springs describes the broad array of patients who depend on her expertise to improve their quality of life.
Facial reconstructive surgery is basically procedures that was designed to rebuild your face because of one reason or another becomes deformed, and for us most commonly is cancer in the head and neck or skin cancer, that we have to resect the cancer and then you have a defect there and we have to come in and rebuild that part of your face to make it look as natural as possible. When we talk about reconstruction, you have to address both the functional and the cosmesis or aesthetic aspect of it, meaning you have to restore function to that part of the face or a part of the head and neck, and also to provide an acceptable aesthetic appearance for the patient as well. I tell patients all the time, we will make you better, but we're not going to be able to make you perfect, meaning it's very difficult to do major reconstructive procedure and have people look exactly the same way they did before they had cancer removed from their head and neck or something like that. When you reconstruct, you have to reconstruct the framework if there is or there was a framework defect, and then also you have to reconstruct the lining. Because if you put the framework up without the lining, it's not going to look good and it's not going to function well. It could be a small surgery, it could be major surgery that would require what we refer to as free flap reconstruction, meaning taking tissue and bones from somewhere else on the body, such as from your legs or your arms, and put it up in your head and neck area to rebuild a certain defect. Whenever we reconstruct the defects in the head and neck, we always try to use your own tissue, your own bones, but occasionally we have to use synthetic material, mesh and hydroxyapatite and things like that. Also, the material, we're using titanium most of the time now, and then more recently there's absorbable plates or screws that we use in pediatrics population as well, that will dissolve over time. Also the techniques, like for example in the old days we didn't have CT-guided a CT-assisted surgery, image guidance surgery, and now we do. It just makes everything a lot easier, and also we have access to fine cut CT that can do a three-dimensional reconstruction, or for example a patient with a major head and neck defect, we can have a model made of their facial bones or their defects based on CT findings before we go to the OR. So you actually have that in the OR to look at, to study while you're working on the patient. So it's very helpful and neat, very exciting for me at least.